So when we were looking at the clean indoor air policies in the state of Minnesota, what we found were there were no significant negative economic effects at the community level that came from clean indoor air policies. We looked at employment specifically. So did employment change? That is, did businesses have to lay off some of their workforce after these smoking bans at the community level were adopted? And what we found was really consistent with all of the other studies that had been done up to that point. But this was the first study in a Midwestern United States state where weather is a big impact and whether or not people go out to bars and restaurants, because there's a seasonal effect. When it's cold in the winter, people go out less. So there was more concern that there'd be a much deeper economic impact on those communities when you're in a colder climate.
But there wasn't.
No, we found what was consistent with other states, and frankly, subsequent to this, this is consistent with what's been found in cities, counties, states, and countries that have evaluated economic impacts, and really there are no significant economic effects that have come from banning smoking in bars and restaurants. That's not to say there aren't individual businesses that make claims about this, but when you look at the community, which is how these policies are adopted, there are no significant economic factors. Tobacco is a legal product, and it absolutely, under our current law, is made available at a certain age of purchase. But it also is a very well known to be an addictive product and a dangerous product. So I think there's an interesting tension between the work that we need to do to really make sure consumers understand these products and the risks that they're undertaking. And probably the biggest challenge is that the vast majority of people, it's estimated between about 90% of smokers start before age 18. So that's the legal purchase age in most of our communities. A few of our communities are going to age 21 and up. But most of us are living in communities where you can purchase tobacco products at age 18, yet most people start before that time. And you may also argue that, we've got lots of cognitive and neuroscience evidence to suggest that people aren't necessarily as mature as they might be in their decision-making capability before that age. So young people are making this decision about using this product that's highly addictive. Most young people don't think it's addictive, and if they may think it's addictive, but it's not going to make me addicted. I'm not going to keep using it. So I think one of the biggest challenges in the work that we do are actually related to the fact that this is a product that people perceive to be not that dangerous when they decide to start using it. I think our probably best available evidence is to try many times. Don't quit quitting. People should absolutely continue to try. It takes an average of about 11 quit attempts in order to successfully stay quit for any individual smoker. That's not someone who's necessarily more dependent than anyone. That's on average.